This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and every week on the program, I speak with doctors and nurses, and sometimes with patients. And so I'm excited to bring you a patient story this week. My guests are my wife, Dr. Lyanna LaFredo. Hi, Dr. LaFredo.
Hello. And
one of her patients, Sterling Silverman. Hey, Sterling.
Hi.
Welcome.
Glad to be here.
I'm glad to be here. We're actually in your place. We invaded your house.
Yes.
We came in and we've made a little makeshift radio studio out of your room. Mm-hmm. Is that weird for you, by the way?
A little.
A little weird, right?
It's funny, more so.
Yeah. Let's see. Let's roll things back. Are you 19 years old?
Yes, I'm 19.
So a while back, my wife said to me, if you're looking for a story, you should really talk to Sterling, my patient Sterling. She's cool and she's got a story. And so I started putting it together, and I was saying, well, Sterling, wasn't she the one? I'm trying to figure out where to start the story. Wasn't she living at the Gardens? You were at the Gardens for a long time. So how do we express all this? You're a paraplegic. Mm-hmm. And you... It was 5.5 years ago. Is that where the story really begins?
How did everything start? I think it started before that, right?
It started in 2011.
Okay.
When I was starting my freshman year of high school.
Uh-huh.
I had this thing called foot drop. I would my legs were really weak. My right one was, and it was this condition where my muscles weren't working very well in my right foot.
So you were up walking around, but then at times, did your leg feel really heavy, or how did it?
No, it was all the time, constantly.
Yeah.
My right foot would drop, and it would be really weak.
Yeah.
To the point I would be falling every 5 or 10 minutes trying to keep balance.
And when this was going on, your other 3 limbs were okay?
Yeah, everything was pretty much fine. I mean, yeah.
Okay, let's pause and let's get some medical help on this. What's this all about, doctor?
Well, to me it seems like, were you feeling any sensation in that foot, or is that gone as well?
All my sensation was there. It was really just the muscles.
Okay.
And wait, I'll let you continue because that's later.
Okay. So there seems to be something in her spine that's affecting that part of her spine that's responsible for motor function. That's usually when you look at the spinal cord, it's usually the back part, the part of the spinal cord that's closest to your back.
Oh, okay. Yeah.
Is motor control. Yeah, so there's probably something going on there.
Sterling, you've probably learned all of this along the way, right?
Yeah.
Yeah, you're sort of an expert on it now.
A little more than I wanted to be.
Yeah. So you were a freshman, and your foot was kind of dropping, and you were stumbling, and
you don't recall hurting yourself in any way before this happened,
no,
having
not
any
really.
injury, falling, or yeah.
No.
So what happened next?
Well, basically there was this event in Golden Valley that happens every year. It's called Golden Valley Days, and I went there, and I was still having my normal weird foot thing. And I was hanging out with friends, and I was skipping, and my right leg suddenly kind of popped, and I fell to the ground screaming in pain, crying. And so that's when I went to a knee doctor first, because they thought it was something in the knee that was causing the foot drop. Mm-hmm. So after I went to the knee doctor, they said there was this little muscle or something in there that was twisted around, but I ended up going into surgery for my knee.
So after surgery, though, were you up and walking around again after that?
Yeah, no, that I was fine. I still had the foot drop, but they told me, because before that I wasn't able to walk at all because of how much pain my knee was in. But after the surgery, I was able to walk the same day, and I was going fine.
Yeah.
So
surgery wasn't a big deal. You were up and moving around again. You still had the foot drop, and so something...
So my dad finally, at the time I was living with my mom, But after I started living with my dad again, he finally like realized something was going on. And so he, like, after the surgery, since it wasn't fixed, he like went to a neurologist. He said it was either something in my spine or my brain. So they wanted to do a MRI and a CAT scan to make sure and see if everything was okay. After they did the MRI, they saw something was wrong, but they didn't know what. They knew like that there was something going on with my spine. So the doctor that I had, he recommended me to a surgeon in Las Vegas. And so he did another MRI that had the dye put into your spine, and they found a hole in my dura, and my spinal cord was stuck in that hole, like kind of like tethered. And so basically they didn't want to send me home, so that night I was like stuck in a hospital bed. They were just like, oh, you get surgery in the morning.
Wow.
Because apparently within like 2 weeks, or like it was too serious for me to start walking around, because I would have either been permanently paralyzed, which I technically am, but either permanently paralyzed or I would have died.
Wow.
So
how does, Dr. LaFredo, how does this sort of thing, is this kind of a genetic anomaly, or was there something that could have been done?
It's something that's probably you were born with, and you didn't know and didn't present itself until, yeah, it's a congenital. But there's no history in the family of...
I wouldn't know. Both of my parents are adopted. Mm-hmm. But we think it's spina bifida because my dad was exposed to Agent Orange in Vietnam.
Wow.
Yeah.
So the next morning you went into surgery, and the goal was that they could fix it and you'd be able to, I mean, they'd repair you.
They didn't really warn me, to be honest. They didn't tell me that there was a risk of being a paraplegic, which, like, I mean, obviously there probably was in a contract or something that they had assigned.
It was in the fine print.
But it still would have been nice to have like, oh, by the way, this is a serious surgery. You could be a paraplegic. Like, but that like never happened. And so, 1 minute, like that morning, I was like, okay, surgery, woo, I'm gonna be fine. Right. And then I woke up from anesthesia, and like all I know, like every single time I go through a surgery, when I wake up from anesthesia, no matter what, I cry. Like, that is just my symptom. So, although it was serious and probably a crying moment, if I would have been more in my head, I still was crying, and I was like, I can't move my legs. And then I just passed back out. And so what they thought originally was that it was the anesthesia that was causing it, and they were hoping when it wore off and I woke up that it would have been back.
But that never happened.
No, it didn't. When I woke back up, I couldn't. Apparently, like, I've read the documents over like what the doctor had said. They said that there was like movement in my toes and stuff, but I don't remember that at all. But then again, I was so drugged up that week, so I have no idea. But either way, I couldn't move my legs.
And you didn't feel anything?
No, I didn't.
Yeah. And that was, you were how old at that point?
Oh, I had just turned 15.
Yeah. I mean, I know that's serious territory, but like, what is that like when you're 15 and you're thinking, I'm probably never going to walk again?
Well, okay, at the time, they told me I was going to walk again.
They did, yeah.
They did, yeah. They, like, were like, in a few weeks, you'll be fine, and... But, yeah, no. A few weeks went by, and nothing was... Yeah.
How long did it take before, you everyone realized that you won't be able to walk again?
Well, the way I look at it is... Honestly, I still have hope I will walk again. I know it probably won't be by my own hand, but I've always had that outlook that there's so many scientific advancements and things like that eventually I may walk.
Yeah.
And so basically, since I've always had that outlook, I wasn't really that upset, to be honest. I mean, of course there's always bad days, but I've never like had that like set of, oh, I'm really depressed, I can't move. Like, I mean, there may have been one point, but that was like later when I was bedbound for a while because I couldn't get out, I couldn't do anything. So but when it came to like in the rehab and everything, I always made sure that I like was trying my best.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Sterling Silverman and Dr. Lyanna LaFredo. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. The Wound Healing and Hyperbaric Center at KRMC cares for patients with chronic wounds, arterial and venous wounds, and diabetic wounds. Our staff combines advanced technology, intensive medical intervention, and compassion. KRMC. And welcome back to Focus on Your Health. I'm TG LaFredo, and this week my guests are Dr. Lyanna LaFredo and her patient, Sterling Silverman. I remember some years ago, a weekend, you and I were out in Kingman, and you said, okay, well, I need to stop by the gardens because I have a patient there. And I was like, the gardens, aren't they mostly old people there at the gardens? And she's like, yeah, but I have one patient there. They do take younger patients when need be. How long were you there?
How long was I there?
Wow. I don't even.
Months, right?
Was it a? What? Yeah, I think
It
it
was
was more than a month.
Yeah,
So
it was
a
definitely more than a month.
Oh, I think
yeah,
it was.
a couple months. I think.
I think.
or
At least.
Yeah.
Because I remember another time we had to stop by, and I said, "Is this the same patient? She's still there?" Yeah, she is.
Well,
Yeah.
at the time, I was bedbound. So they, like, I don't know. I'm not sure if I knew you, like, if that was the first time I saw you or...
Yeah, I think the first time we met was in the hospital because he had that MRSA infection.
Yeah, and then you sent me to the gardens, if I remember
And
right.
then, yeah, because it was so bad. I mean, mostly what we're doing is just making sure your wound got healed
Yeah.
completely, and you didn't need to be on IV like antibiotics
Yeah.
anymore, but just to let her wound heal. So sort of like recovery.
I guess what I'm really wondering though is like, you know, when you're bedbound, what was a day in your life like, and how did you? I mean, was it a depressing time, or did you find stuff to do to keep you occupied? And
Okay, when I first started getting bedbound, that's when I started to get into video games again.
yeah,
Because when I was young, I used to play video games all the time on my PlayStation 2. I loved it. And as I got older, I would still go outside because I was like a tomboy at heart. But as I got older and I got friends, like video games kind of like took a step back. But after I got bedbound, I like one day, I think it was my brother who let me borrow this game called Dragon Age Origins. And so I started playing this game. It's an RPG, and it basically like just like set this whole like path of wanting to go into game design and wanting to do stuff again, like with my career set. I mean, I still had like I was still fluctuating between like other choices when I like went through school and everything, but I was mostly interested in games at the time because that kept me from being bored and sad.
right. So let's come back to that. Mobility has been difficult, and you were able to enroll in an online high school, right?
Yes.
So you were taking classes, and this spring you graduated.
I did.
So congratulations to you
Thank
for
you.
that. And this is where, you know, I mean, like, I hear parts of your story and I think, oh gosh, what an awful, for a young person to go through all that. I mean, it's a lot, right? And yet standing here and listening to you and talking with you, you're so positive and you've got so much going on, so much that you're excited about. And I think that's really inspiring. So we talked a bit about where you've been. Where are you going? What's ahead?
Well, I need to get a couple of surgeries done, which Dr. LaFredo has been helping me, referring me to hip doctors, and then they've referred me to other hip doctors. But I have a dislocated hip right now, and so since I can't feel it, they're kind of just letting it hang, sort of. But basically, once they get the hip fixed, I also want to get a surgery on my feet, because right now my feet are completely straight to where I can't bend them at all because I wasn't able to stretch them when I was bedbound. And so when they bent my legs, bent my feet, they would kind of just like, they were so like straight and tight that I couldn't bring them up. So
tiptoed position.
So you have a couple of surgeries coming up. You got to get through those.
After that, I'm going to be going to MCC, I hope, so that I can get some pre-college classes done, because the program I was in online schooling, although I am grateful for them, because if I went to a regular high school, I wouldn't have been able to graduate. The problem was they put me on a homebound plan, which was, it made the requirements like for credits less than the state's requirements. So when it comes to universities and stuff, they wouldn't be able to accept me most likely because I'm so behind. So I'm going to be going to a community college to catch up as much as I can, and then I want to go to a university to major in game design and creative writing.
So for MCC, would you be able to attend classes online, or would you actually be going to the campus every
They have online classes and a physical campus, but I want to go physically because I want to prepare myself for a university in the future.
Yeah.
Because I want a not a high school experience, a college experience, since I didn't get the high school experience.
Yeah, I got it. So you've already said that you're way into video games, and that's something you're interested in. Talk a little bit about the creative writing aspect.
I've always written a little bit, and whenever I've written stories in classes, my teachers have always said, "Oh my God, you have a very creative mind, or you have potential in writing."
So is it fiction that you like to write mostly?
I do mostly like to write fiction more so. Yeah. But as I got older, I stopped writing. I still don't write as much, but I have written a couple of papers about my situation and stuff to my teachers when I've had writing classes. And they've also said, one of them told me that I could end up being published one day if I kept working at it, which was very exciting. Yeah. But the main reason I want to also major in creative writing is because it goes with game design, because you have to write this entire story with a game, depending on the game you're creating. Yeah,
it's like writing a script for a movie, sort of, right? You need to have a vision for every aspect of it.
Exactly.
It's awesome, and it's this world of imagination, and for someone who's creative and likes the narrative, I mean, I can see where this would be a really nice fit for you, right? Yeah. We were talking on the way out here, Dr. LaFredo, and we were saying, I was just thinking someone who has trouble with mobility, maybe 20 years ago, something like that, imagine how much more difficult that situation would be. What I'm thinking about is the way technology has made information and education, not to mention
more readily available.
Yeah, sure, right, and not just that, but also, medical advances, of course, right? Yeah. And I'm just kind of reflecting on this because a few minutes ago you said, I probably made a mistake. I said, so you thought you'd never walk again? And you said, well, I've never really thought that,
I've never really thought that.
So that's super cool,
It's very interesting when you think about the past when there weren't technology advancements. I probably wouldn't be even alive right now because of the fact that like, it depends how far you look back. I might be like bedbound and like unable to do anything, unable to get an education. I could be dead because they're like, surgeons wouldn't have known enough about my situation in order for me to live. So, I mean, I'm definitely glad I was born in this era.
Yeah. Yeah. I mean, and there's so much you're capable of doing that you just wouldn't have been able to. And it's an exciting, it's a good time, I think.
Yeah.
Right?
Mm-hmm.
Sterling, I had a feeling that you would be okay with sharing the story and giving us, you know, a look at your adventure. And that's because you have do you call it a vlog? You have sort of this video journal that you put up online.
Yeah, I
right?
do.
Can we talk about that?
Yeah, sure.
So what do you do? What's that about?
Okay, so that video blog started when I was like 13 or 14. Me and a couple of friends were bored one day, and so we decided to record a video. And so those are like there's quite a few of them on that channel. But eventually, as I became paraplegic, I lost touch with a lot of people that I like used to know. And so I basically ended up starting to, like, one day, it was my 2-year anniversary of becoming paraplegic, and I was actually very upset that day because, I mean, anniversaries are kind of sucky. Usually on that anniversary, I just let myself have a day to sulk. But so on that second anniversary, I decided to make a video just thanking everybody for being there for me that I did still have. And that video ended up like with 9,000 views, which was insane. Like, I didn't expect anything really. I just wanted to rant. But then I created a couple of other videos. So when I like have like an event I want to talk about or something else, then I eventually just like do that, which also was why I posted my graduation speech.
Yeah. And I wanted to ask you about that. How can people find it if they want to check out your page?
All they really have to do is go to YouTube and type in RAR 981.
That's RAW?
Mm-hmm.
RAR.
Yeah, like.
What are the numbers? RAR
981.
981 to check out Sterling's videos. And one of them is that you are speaking at your graduation. They asked you, what's the story? How'd that happen?
So for a while there, I have this, like, I don't know what to call her. Her name's Erin, and she's, like, the most amazing person ever. When I couldn't advocate for myself in school, she advocated for me. And so, basically, I, like, one day she came to me, and we were just talking about graduation, because it was getting pretty close. And she was like, oh, and I'm having you do a speech, and then, like, kind of, like, casually went on to, like, a different thing. I was like, oh, wait, go back a sec. What are you doing?
Surprise.
Yeah. And she's like, oh, yeah, no, I've requested with the principal that you're doing a speech. I was like, what? And I was so nervous. Like, I just kept stuttering. And, I mean, they liked it, like, the speech, because there was a lot of clapping.
Oh, I thought it went well. Yeah.
Yeah, it was still, like, very awkward. I felt like I was going to pass out the whole time.
That's pretty much what it feels like when you're doing the public speaking. On the way out here, Dr. LaFredo, you were saying, you know, again, we were talking about coming out to do this interview, and you were saying, you're kind of reflecting on some big picture lessons from working with Sterling. Yeah.
Yeah. I mean, like I said, I told him about your story because it was inspiring. You know, it's really a nice story about how, because you have such a positive outlook despite everything, you know, that happened. And so your story is inspirational, and not just to young kids like you who might have that same or similar situation, but also to doctors, to us, to me, because it, you know, just reminds me how just having a positive outlook helps a lot. And then we should, as doctors, really kind of encourage that and kind of like help as much as we can to help you reach your goals. So yeah.
I do have one comment though.
Sure.
Like, I don't see myself as an inspiration, to be honest, because I think if somebody was in a situation as mine, they would have to either choose to keep going or just kind of lay down and waste away. And so, like, if I am seen as an inspiration, then you have to consider all the other people that are in similar situations as me that have gone, like, through something. Like, each paraplegic or quadriplegic or any serious medical condition is at least a little bit different, as, like, you have a person's personality and just different side effects and whatever. But I think that you have to consider that those people are also inspirations because they're also making it through. So,
Yeah.
like, even if we don't, like, me personally, I don't see myself as an inspiration because there's so many people like me, even if they aren't recognized, that if somebody, like, who, like, let's say saw this, well, listened to this thing and then, like, ended up getting in an accident, they would just kind of, like, need to think about the fact that they need to keep going. They, like, can't afford to give up, because if you do, then there's just, it's not okay, basically.
Yeah.
I'm smiling because she says you're an inspiration and you say I'm not really an inspiration. And I'm thinking that's just what an inspiration would say.
Yeah.
Sterling, thank you so much.
You're welcome.
And that's the show. I'm TG LaFredo. My thanks to Sterling Silverman and Dr. Lyanna LaFredo. And thank you for listening. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. We'll catch you next time.
This is weird. I'm talking, like, oh, okay. Am I done yet?
No, keep babbling.
No? Why am I babbling?